Hi everybody. So I just wanted to share with you this case. I see this fairly often, especially with clinicians who haven't done too many removable prosthetic cases. When they will take a custom tray and overextend borders quite drastically with either the use of compound or heavy body material. And the reason is not the compound, not the heavy body, but the tray itself probably wasn't trimmed properly um, to the myostatic outline, and then because of that you have all these areas right here. So if you look right here, I'm going to use this tool right here to add a little bit of wax so you guys can see what I'm talking about. So I got this area and this area right here. It wasn't too visible in the beginning. Now this is where the mentalis muscle is, and usually the denture base usually goes about halfway up through this mentalis muscle. In this case we have it overextended past this point all the way. Okay. If you look right here in this zone, this is where the retromolar pad areas are. And the great thing about this case, we actually have the retromolar area zones. The problem there, when you capture this impression and the patient's biting all the way open, and they're really lowering their jaw down, it stretches this area quite a bit and causes the severe extension of retromolar pads. This causes two problems. When you're fabricating a denture, patient doesn't usually wear their denture with their mouth severely open, so it destabilizes things. And also, when you're doing the plane of occlusion, we usually go 3/4 up the retromolar pad. Well, when the retromolar pad is relaxed, it's about right here, and 3/4 up on this is going to be right about here, causing the plane of occlusion to be off, right? So that's the second thing that I see. The third thing I want to talk to you guys about is the mylohyoid ridge, right? So in this case, especially, you can see very well the blockout is done right there under the mylohyoid ridge. This is our mylohyoid ridge right here. Okay, so dentures usually go about 2 millimeters below the mylohyoid. So you want your impression to represent that, and that when you're doing a functional impression, the patient needs to stick their tongue out. They need to make movements to side, and they need to swallow, and that's going to give you proper impression in this area. And in this case, you can see that it's really overextended because the mylohyoid ridge is right here as well. So this whole area is a mylohyoid, so it's extended down quite a bit. Okay, and last but definitely not least, it's extended severely into the buccal mucosa. So if you look right here, usually the retromolar pad is right here, and it goes to the external oblique ridge. In this case, it's a little bit difficult to tell. It could be this, but I think it's probably around this area right here. So what I would probably do is I'll probably make the tray kind of fit into this, and we can trim it down when we need to. And obviously we're going to have to do a lot of trimming chair side with this base plate. And what I would recommend probably is to actually use that, and once you get it trimmed, take a wash impression to get a better representation of what the interoral area is for the prosthetic, because right now it's not looking that great. So what I'll probably do is I'll go right about right here and try to capture this zone right here, and I'll go all the way down to here and just let the doctor know that we need to trim up, or maybe I'll trim up later myself once it's been printed. Here it's a little bit difficult to tell where it is, right? So I'm just going to go about right here, because in my opinion maybe that's an approximation where the external oblique ridge is, and I'm going to go all the way down to this area and then just go along the borders given to me with the impression. This is what I'm going to do. Now you have to understand, this is just an approximation, a really severe approximation of what I think it needs to be. We're probably going to have to trim this pretty much halfway through to get the size that we need. So we're probably right about here right now. So I'm going to print this as is. So because in all reality our base should be probably right about here for the mentalis muscle. This will probably go up a little bit. So actually maybe this is a little bit better approximation, so let's leave that right here. Okay, and here we're about right. Just even this out just a little bit. Okay. And let's see what that looks like in a preview. So I'll make my bases to be about 2 millimeters in thickness, and that usually works out pretty well for me. So that looks about right where I want it to be. And like I was saying, we'll need to trim this down a bit more when it's done. Okay? This is what I wanted to show you guys. Thanks so much for watching. Have a great day, and good luck.